Hello, my name is Liz Tyser, Public Health Emergency Coordinator for Johnson County, Kansas. This Dispense Assist training is brought to you by the Johnson County Department of Health and Environment with funding provided by the Centers for Disease Control Cooperative Agreement. All information provided in this training is for educational purposes only and should not be relied upon solely for emergency planning purposes. Processes, products, and trademarks shown are only for examples and do not reflect a specific endorsement of any product. Dispense Assist was created and is maintained by the government of Johnson County, Kansas. There are a variety of prerequisite trainings recommended before completing this training video. These prerequisites may help you better understand the statements, processes, and basic principles referenced but not discussed during this video. Basic Dispensing ICS 100 and 200. The following topics are covered in this training. Use of Dispense Assist by public health. Use of Dispense Assist by hospitals. Pills versus influenza vaccination. Importance of annual use utilizing seasonal influenza. Dispense Assist was developed by the Johnson County Department of Health and Environment as its solution to the medical countermeasure requirements of the City's Readiness Initiative, or CRI. The planning standard requires the entire population of a jurisdiction to be provided with life-saving medical countermeasures within 48 hours of the decision to provide them. For Johnson County, that's over 500,000 people. Dispense Assist was conceived as a local solution based on the work and research of health departments in the San Francisco Bay Area. The screening algorithm, question methodology, and written protocol were all developed in the San Francisco Bay Area, but used with permission to develop Dispense Assist. DA works by allowing the public to complete their medical screening online before dispensing sites open, thereby expediting the dispensing process. The public health industry uses Dispense Assist in a variety of ways, from annual exercises to anthrax-only responses to everyday clinical use. How your hospital uses DA will also vary. Because DA is available on the web 24/7 and is available for installation on local networks, how you use DA in day-to-day clinical activities is up to you. There is no cost to use DA, and assistance is available through the website. The focus of this training module is to address how hospitals can use Dispense Assist on a regular basis to administer seasonal, flu, and other vaccines. For training on how to use DA for mass dispensing, please view the DA Basic course. The Dispense Assist process is very simple. Our example today will focus on a seasonal flu clinic for hospital employees. Hospital employees receive a link to the influenza vaccine screening form on the Dispense Assist website. Employees may also be directed to an internal website where they will be asked to complete their consent form online, also known as the voucher. They are instructed to print the voucher and bring it with them to the clinic. They are asked to include either their department and/or employee ID number in the Address To box. Later in the video, we will review what you can do with the Address To information. The more reminders with the online link that you can provide, the more likely staff are to arrive at the clinic with their completed voucher. Employees arrive at the designated time and place for your flu clinic. Question: does the employee have the voucher? If so, direct them to the vaccination station. If they don't have a voucher, provide them an opportunity to complete one at a kiosk or other computer station you provide on site, or ask them to leave and return with a completed voucher. Vaccinate and document. Many hospitals have different documentation processes. Some scan the voucher as soon as the person enters the clinic. The information is sent to a computer where labels are printed and provided to the vaccinator. The person is then directed to the vaccinator, and the voucher is labeled accordingly. Others simply have generic labels with the lot number, expiration date, vaccine provided, and the manufacturer's name. Your hospital can choose to implement Dispense Assist any way it wishes. Use of the QR code at the bottom of the voucher is an option as well. All information above the client's signature line is captured in the QR code. The information on the Address To line of the voucher can be extracted into a database and cross-referenced with employee data to track vaccination of personnel. The process related to providing influenza vaccine using DA is only slightly different than when using DA for pill dispensing. The voucher information is exactly the same with regards to demographic information, screening question responses, and where to document the lot number and what was provided to whom. The difference is in screening. DA will screen for one medication or the other for pill dispensing. For influenza, DA only determines if the person is medically eligible to be vaccinated. Dispense Assist does not make a determination of what vaccine to provide. The responses to the screening questions help the vaccinator determine the appropriate vaccine to administer based on the jurisdiction's, agency's, or hospital's protocol. Only the first 3 questions determine if the person can or cannot receive vaccine. The rest of the questions determine which vaccine to provide. They are directed to the vaccination station with their voucher. If no voucher is provided, then that individual is not a suitable influenza vaccine candidate. The more hospitals and other seasonal influenza providers that use DA, the more they and the public will feel comfortable completing the online voucher and going through the vaccination process. One of the key messages when sending out the link to Dispense Assist is, save yourself time in line, complete your voucher online and bring it with you. As more routine vaccines are added to DA, there will be more opportunities to use it on a regular basis. Many hospital systems, clinics, and private practices have adopted Dispense Assist as their only screening tool for seasonal influenza. Please go to www.dispenseassist.net for the latest information.